This is one of the most common mistakes that I see in people's hip-controlled articular rotations, especially when we're doing a quadruped hip car. So I'm going to come from hip flexion into hip abduction. Now I want to think about leading with the outside of my knee so that when I'm in that top position, I should have a relatively level leg. So hip, knee, foot look relatively level. What often happens is people end up kind of leading with the foot, and that means that their thigh ends up in a more internally rotated position at the top. So I want you to think about in that top position, or the whole time we're bringing the leg out, you want to think about leading with the outside of the knee, rotating the foot down, and then that will bring the leg into a more externally rotated position. So we don't want to finish it here, we want to finish it in that position as much as possible, and the more you practice, the better you will get. And a similar thing happens when we're coming from hip extension and we are abducting out. So we abduct and then we need to externally rotate, pull the knee up and guide the leg down. And again, what often happens when people have weak hip external rotation is it's actually hard for me to do this because I've worked my way out of it. As they don't get that external rotation, so they kind of jump from this abducted position and they just sort of come straight down. So when we need to abduct and then keeping the knee as high as possible, rotate that heel down again, try to externally rotate as much as we can. Abduct, externally rotate as much as we can. Once we've hit that stopping point, we pull the knee up towards the elbow and then we guide underneath. So in both stages, it's just making sure we're actually getting as much external rotation as possible from coming underneath, making sure we're externally rotated, and coming out at the top, trying to externally rotate as much as we can. Whilst we're doing that, we also want to limit compensation. As we're doing that external rotation, that's the point where you're most likely to compensate. But as people are trying to externally rotate, they might lean into the other leg, they might hyperextend the spine. So we want to try and keep the rest of the body as still as possible. Abduct, and remember, we're trying to externally rotate, then move into internal rotation, then squeeze up and guide in. And when we come the opposite way out, we extend, we abduct out, keep the knee as high as possible, start to rotate that heel down, and then once you reach that stopping point, pulling that knee through, still externally rotating, and then guiding underneath. Whew. Last but not least, we are always trying to find more rotation throughout the movement. So we flex, we abduct, not leading with the heel, leading with the knee, as high as we can, squeezing into that glute. Once we reach that stopping point, we then start to internally rotate, trying to keep the knee high. Once we reach that stopping point, you can then start driving the heel up towards the ceiling to hip extension. But as I'm doing that, I'm still trying to find more rotation, and then squeezing the glute, bringing the thigh in towards the midline and guiding back underneath. Hip extension, squeeze that glute. This bit, imagine you're sliding your thigh across a coffee table, but you're trying to keep your shin vertical, and you get as far out as you can. Once you hit that stopping point, try to keep the knee high and start rotating the heel down. So now we're finding more external rotation. Once you start to reach that stopping point, you can start to pull the knee up towards the elbow, but you're still trying to rotate, you're still trying to keep the knee high. Externally rotate, 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 rotate. Start to pull the knee towards the elbow, and then guide underneath. Wowie. I've not done I've not done a talk through for a while, and I need to practice. I'm also at the end of my leg workout, so everything is tired. But because I was talking, I was probably losing my spine position a little bit whilst doing all that. So I want to keep my spine not like super stiff, but neutral. So when I'm doing all of these movements, I don't want to be rotating, flexing, leaning into the other side. Just want to be trying to keep the rest of the body as still as possible to isolate the hip, ball and socket joint.